Thank you, Dr. Musad, for the nice introduction. So today we're going to talk about the Damy activities. It's your charity. Damy is your charity. We're going to go through the Damy journey in blood donation. We can share our experience with you and negotiate or discuss the challenges that we face and take recommendation from your side. Okay, this is just background about the charity. This is the vision, mission, values. I'm not going to go in details on these. And these are our objectives. Mainly focus on increasing the voluntary blood donation and taking care of blood donors and increasing the awareness of our community towards the importance of blood donation, and also contribute in improving the blood transfusion services with other sectors. And also the last objective of our charity is to provide financial support for patients who are transfusion-dependent patients. Okay, Damy started as a committee in 2006 by His Royal Highness Prince Faisal bin Mishal bin Saud bin Abdulaziz, who established this as a committee. In 2012, was upgraded as a charity. In 2020, got a name as Damy, as a slogan, Damy. Damy in Arabic means my blood. Okay, I would like maybe to show you brief video from His Royal Highness Prince Faisal bin Mishal bin Saud bin Abdulaziz. The sounds, please.
فبحثنا الحقيقة كثيرا عن فصيلة الدم. في آخر يعني البحث وجدنا هذه الفصيلة لدى بنك الدم في المستشفى المركزي، مستشفى مجمع الملك سعود في مدينة الرياض. لعلها كانت هذه يعني الحادثة من أسباب أنني تشجعت يعني إنشاء لجنة أصدقاء بنوك الدم، ثم بعد ذلك تحولت إلى جمعية أصدقاء بنوك الدم التي نسأل الله سبحانه وتعالى أن تكون عونا لكل الإخوة أو الأخوات غير موجودة. فبحثنا الحقيقة كثيرا عن فصيلة الدم. في آخر يعني البحث وجدنا هذه الفصيلة لدى بنك الدم في المستشفى المركزي، مستشفى مجمع الملك سعود في مدينة الرياض. لعلها كانت هذه يعني الحادثة من أسباب أنني تشجعت يعني إنشاء لجنة أصدقاء بنوك الدم، ثم بعد ذلك تحولت إلى جمعية أصدقاء بنوك الدم التي نسأل الله سبحانه وتعالى أن تكون عونا لكل الإخوة أو الأخوات المرضى المحتاجين لقطرة دم لإنقاذ حياتهم.
So, yes, thanks to His Royal Highness for establishing this committee. Can we go back to the presentation? Yeah, I mean, as we started as a charity, we had to put like a strategic plan. So we sat together. We went through the strategies for blood donors recruitment from WHO, and my talk came after Mr. Jumbing, and also my talk came after Dr. Ali, who is from WHO, and also we took the recommendation from International Federation of Red Cross and Red Crescent Society, and also based on our recommendation from the first conference back into 2019, and also we looked at the reports and published articles about the blood donation status in Saudi. So we went through all these, and we came up with our strategic plan that started from 2020 until 2025, so we'll have one more year. So we did the SWOT analysis. One of the most strength points that most of our population in Saudi are in the donation age, and this is Good point. Also, there are self-motivation, also religious motivation for blood donation. But the weakness is that there is no suitable blood donation center with suitable time. Like people would like to donate, but there is no suitable, like they face like boundaries about the time, the difficulty to get to the blood banks, and also there is no sustainability in voluntary blood donation. Also, there's a weak female contribution, as Dr. Ali said. And we found that many opportunities that if we create or establish a new blood donation center outside the hospital that got, attractive, more convenient, more flexible in the time for the donors, and also to increase the donor satisfaction and also enhance the donor retention. Threatens that there is no sustainable financial support for the charity. And also, there are a lot of change resistant from our community, also from authorities. However, we came up with four main projects to achieve 100% voluntary blood donation. All these four projects, they have to go side by side. They go in parallel. The first one is to increase our community awareness for the newcomers, to increase the awareness of our community, to get new donors. And also, at the same time, we have to provide suitable, more attractive donation centers and improve our donation environment. And also, we have to also improve our professional skills, how to deal with donors, to treat our donors in a good manner. All these, or at least the last two projects, they definitely can enhance the donor retention. So these are our four main projects, and there are sub-projects underneath these projects. So let's start with the first one, community awareness. To increase our community awareness, there are a lot of activities, but I can classify them in three main sub-projects. The first thing is participation in exhibitions, conferences, national and international days, and we have a lot of activities. This is a kind of a traditional awareness campaigns that you give people brochures, you give people like a leaflets with information about important blood donation. So the charity contributed in all national days, on all international donor days. And also we had approaches the universities, the colleges, especially health colleges. Also we contributed in other scientific events with our colleagues in Saudi Society of Transfusion Medicine and other conferences. We contributed like in all Saudi Society Transfusion Medicine conferences. We consider them as our partners. And also we participated in the festivals that run in Qasim or outside Qasim, such as Coffee and Chocolate Festival, exhibition, and also annual Buraidah Spring Festival, which is run annually. We contribute in that. It's just to communicate or to educate our population or our community about the importance of blood donation. And at the same time, we run donation campaign at the same time. Also Kleja, I bought a separate slide for Kleja because Qasim is famous about Kleja. It's kind of traditional thing. So we contribute also on the Kleja Festival, which is annual in Qasim. Also we run an award blood donor date. So this is just like a small statistic about the number of people who get educated. Like in 2020 or 2023, almost 13,000 people who came to our center or came to our booths to get some information. This is one of the I would like to call it as a traditional education approach. However, we moved to another project which targets students at school at early age. And this experience we learned from Scotland in the previous or in the first conference back into 2019 when we asked Ms. Lane about how they reached 50% female donation and 50 male donation. She told us that we started this early. I mean, we started 20 years ago approaching the schools, the female school, and signed like an agreement with the students. If you want to be a donor, when you reach like the donation age, you have to follow this healthy diet and healthy lifestyle. So we did the same thing. We invited the schools to our centers, as you can see here. So approaching the schools, and we give them like short courses, educating them about the importance, the condition, and how they become like a frequent donors when they reach the donation age. And you can see here the student carried like an agreement. It's not compulsory agreement, but just to encourage the students. They may hang it in their bedrooms to remind them, if you want to be a donor, this is the good or the healthy lifestyle and healthy diet. So, and we found like a good response from our students. So total of almost, 1,100 male students and around 1,500 female students benefited from this initiative. And the third approach for educating our community, we established something called Damy Academy. And this is like an interactive platform. This is not traditional, and this is to best of my knowledge, this is first charity that implements this education system. This is an interactive platform, it's easily accessible at any time. No need to ask the people to come to your center, so we just distribute the barcode. If you can read the barcode, the QR code, if you want to go through it. So you can read the QR code now. I'll show you like just a short video just to know what I'm talking about. Okay. So this is like if you look at the right side, this is the panel. The main subject. Okay, it's going so quickly. So anyway, this is like the things that the student or the one who wants to get educated go through. It's first thing. We got a pre-exam to evaluate the awareness at the beginning. Then the journey is classified or 3 stages: pre-donation, donation, and post-donation. It's just a virtual journey that if the applicants go through the donation as if he goes to donation center. So the first thing we do like pre-exam to evaluate the awareness, then pre-donation, the condition of donation, then during donation what's expected to be done, and post-donation what's supposed to be done, then post-exam to measure the impact of this journey. And this journey we can measure the impact. We can follow up if you play it back, please. Can you play the video back? Play it again. So this is the pre-exam, and then you go, what do you know about the donation? And so definition of the donation, who's going to benefit from your blood when you donate? And this is the donor deferral. This is like benefits from blood donation. This is conditions for blood donation, and how to be ready for donation. It's interactive, some animation. We try to make it like attractive for the students. Then donation steps. Then after donation, before you leave the donation, what should you do? Then where can you donate? Then another thing, post-exam. The good thing about this is it's very cost effective. And can you go to the next slide? Okay. We had almost now 1,600 participants so far. It's not officially launched yet. Hopefully today we're going to launch this academy, okay? We got almost 1,600 participants so far. The average time for the journey took the applicants around 14 minutes. And we got feedback, more than 97% prefer this approach than traditional approach, okay? As I said, it's easily accessible, wider range. It's not restricted to age group or any region. And we can follow up the applicants. Once we launched the first time we tested, we found people stop at one of the video because it's very long. So we changed it and we worked fine. So I mean we can follow where the applicants draw back or draw out from the journey. So we can improve our education material to make it convenient for all applicants. And we can also build a database out of it, and we can evaluate awareness about blood donation, and easily managed, producible, and cost-effective. Okay, this is the journey. The second project in our strategic plan is to improve the donation environment. As I said, one of the major boundary for our donors that they don't find a suitable donation. So we've thought about establishing or creating centers outside the hospital, easily to be accessible, flexible with working hours, convenient and more attractive. And so also we use these centers as access points to our community to educate them and change the mindset about the donation, because I mean, the mindset or the perception about donation is linked to the hospital and diseases. What this is not linked to the hospital. I mean, it's just like a physical activity. Also change the donation experience for donors from being individual to a family experience now, because whole family come to our donation center, and we have now so far 8 centers in Saudi, in the kingdom. This is the first one. Hopefully, we're going to visit it today, inshallah. So this is in Buraida, opened in July 2020. And you can look at it from inside. So, I mean, you can see there are car parking spots just next to the center. And also we opened in the shopping malls. The first one in Al-Thani Mall in Aneza. That was back in December 2020. Also in Al-Thani Mall, Buraida, June 2021. And also the first branch for us in Riyadh, in Al-Thani Mall, Khrais Road, and is operated by King Fahd Medical City. And you see this is the reception in the right. And also, we are greatly honored that His Royal Highness Prince Faisal bin Sultan bin Nasser bin Abdul Aziz also came to our center and donated the blood. This is like one of our centers that inside the hospital. This is the only center inside the hospital is in El Jouf, because when we contacted El Jouf to help them, they said this is the only available thing that we can do for them. But it's against our direction. We try to build to have our centers outside the hospital. However, since this helps them, we agreed that we establish the Damy Center and the hospital. And this is like also recently we launched the branch in Eastern region, Dammam, and also in Al-Ras. So we have 4 centers in Qasim, 1 in the Eastern region, and 2 in Riyadh, and 1 in Al Jouf. This is just like a picture of our donation centers. And also we run female campaigns. Sometimes we book the whole center just for female. Female can donate any time, but sometimes just to encourage female, we book the center is just for female, just to give them more privacy. And in addition to these centers, we have also three donation trucks. This is the latest one, and was sent to Riyadh. This is like inside it. It's got 3 donations, and this is the second one. And we have also the third one. It's not only that. Also, we got responses to the pandemics that happened during COVID-19. We run 3 initiatives. The first thing, I don't know if the translation is correct. We say it in Arabic, خليكم وإحنا نجيكم. So don't come, we come to you. So stay home during curfew. Just stay home. We put like a booking system. So once we have 3 donors, the donation truck moves to them. And we got very good number, 1,166. This is good number during COVID. And also Blood for All, we got 450. And also My Country Without Infection. So these 3 initiatives that as a response from Damy toward the pandemic. And this is just some statistic. You can see like the increased number. There's almost doubling. Like if you see, because we got more centers, more collaborators. So if you see here, the number of campaigns almost doubled compared to last year, 2022. And so there is a steady increase in our activities. But most important is look at the female contribution. Female contribution doubled a lot because they found a suitable place for them to donate. This is one of the things. And in my opinion, if you like recruit one female, in my opinion, you recruited the whole family, because the influence of the mother towards the kids more than the father. Because the father sometimes just, go to donation centers without taking his children. But if you manage to recruit one mother, it seems that you recruited the whole family. This is my opinion. Maybe I'm wrong. Okay, and this is also which I like so much, that the donor satisfaction from who come to our donation center increased from 90% in 2022 to 98 in 2023. We hope to reach 100%. And also, like the percentage of voluntary donation in Qasim, just in Qasim, we reached almost 94% in 2022 and dropped to 91. Okay. The third project is improve professional skills for people who work or deal with donors. We run a lot of programs, and also today we have another program for phlebotomy skills. We run this program several times, and also we run like quality control and blood banks, and also we contributed in organizing the workshop with Ministry of Health about hemophilia, also plasma fractionation. Also, we have also another journey for health practitioners, similar to the one that towards the community. This is for the health practitioners. If we play the video, just quickly, please. Yeah, this is similar to what we do here in the workshop. Is how to deal in a professional way, using effective communication skills with the donor. As just to increase the donor satisfaction and also enhance the donor retention. So if you just skip it to the next slide, because we don't have time. Next slide, please. Okay. In addition to health practitioners, also we look at the number of volunteers, because this is the charity. It depends on the volunteer. If we look at the volunteers, look at the steady increase in the number of volunteers, almost doubling. And this is female volunteers. And in 2022, the total income is around more than $32,000. And increased up to almost $100,000 last year. This is from the volunteers who volunteer with us in our activities. All these projects, especially enhancing the environment and also improving the skills, all will help to enhance the donor retention. Also, we do another initiatives to enhance the donor retention. Yeah, 1 minute. we got like, the donors who got the King Abdulaziz medal for third level, they got, given by His Royal Highness. And also we invite them to our center, give them some gifts and encourage them to be with us. Last thing, it's not related to the volunteer blood donation, but also a project that's related to patients who are transfusion dependent. We provide financial support for them. Last year it was more than $122,000 US. So we got a challenge. It wasn't an easy journey. We faced a lot of challenge. The major challenge is that we operate our centers through third party. These third party are changeable. This is the major thing. Also, if I find the remote centers, and the future direction, I believe that we should go to the university, because they got a student at age of donation. So by this, I'm going to conclude my presentation. I would like to thank the board of the charity, and also our strategic partners and supporting partners, and thank you so much.